Today we're talking about chapter 11. There we go. Okay. Today we're talking about chapter 11. Let's get rid of that thing. Okay. Middle adulthood, chapter 11. Okay. And we're going to talk about this right now. Okay. Middle adulthood runs from age 40 to 65. Uh, most of these people in this picture are, well, maybe they're between 40 and 65. He might be 65. The rest of them may be 40. Traditionally, it may be the most productive period of a person's life, though the end of middle age probably signals retirement. Not everybody retires. You can look at Wilson if you like. Wilson worked until he was 88. Somebody else King Mike just retired. King Mike is 75. So people do work beyond age 65. If you work till you're age 70, you get an optimum amount of Social Security. So that's a good reason to work longer than 65. If you retire at 65, you get a median amount of retirement money. And if you work until you're 70 years old, you get an optimum amount of retirement money. There are potentially many changes during this time period that point toward a slowing down of people. Ageism is a problem. Ageism is the unreasonable and irrational beliefs concerning people as they age, that they're ugly, that they're mean, and that they aren't bright. They're suffering from dementia or whatever, Alzheimer's disease. Modern society relishes youth and denigrates aging. Of course, you don't see very many old people on commercials. They don't sell things very well unless it's one of those commercials about a COPD or something. Physical attractiveness is defined by youth, and people insult those who show signs of not fitting into their definition of attractive. And of course, that's kind of unfortunate. I guess people reaching middle age will spend tremendous amounts of money to appear younger. And these guys have done something. I'm not exactly sure what they've done. Facelift, perhaps. There are reasons why the aging process is not well understood. There are many factors that are tied into that include life traumas, the environment that you live in. Is it harsh? Is it easy? Diet, debts accrued, such as smoking tobacco, that's bad for you. Drinking alcohol, that's certainly bad for you, and or taking drugs, and all those things can make you age faster, especially crystal meth. And of course, genetics have a lot to do with it as well. This is where I used to live in Montana. You can see this was right up near the Canadian border. It was a pretty harsh environment, pretty tough to live in. The diet you eat, if you supersize it every time you go in, I don't know if they even have supersizing anymore. But you're going to turn into a chub. Um, Life trauma that you've gone through. These are refugees trying to escape the Middle East, the war in Syria, the war in Iraq, um, the war in Somalia. You know, all kinds of horrible things happening around the world. And here these people are trying to survive. They're refugees, and of course, sometimes people do really strange things like shoot up with heroin. I'm assuming she's shooting up with heroin. Actually, she's got these things on her face. I would say that may be crystal meth. Anyway, that can really accelerate your life, and maybe it makes you feel good right now, but when you get to be 65, and you may not even make it to 65. So people die of old age at very strange times. Life expectancy is the statistical figure as to how long an individual can expect to live. When I was born, I was born in 1949, and my life expectancy was 59. Um, and of course, I'm 71 now, and I'll be 72 in October. I've lived beyond my birth life expectancy. Of course, life expectancy now is in the middle 70s. So I'm right there. I'm doing okay. It is actually a statistical average of how long people do live. Every country has its own life expectancy. Third world countries tend to have significantly lower life expectancies than industrialized countries, and there's a reason for this. It's because so many people die young. I used to live in a county. I used to live in Blaine County, Montana. In Blaine County, Montana, if you were white, then your life expectancy was 80, and if you were a native, and Blaine County is where Fort Belknap is, or part of Fort Belknap is in Blaine County. If you were native, Assiniboine or Grovon, it's your life expectancy was 60. Now, you may ask yourself, what in the world's going on here? Well, diabetes, of course, is a problem on the reservation. That is, it's not as serious off the reservation. But the biggest problem was that they were giving individuals $10,000. That was part of their treaty rights. Was they got $10,000? They received a stipend of $10,000 when they turned 18. So what these kids were doing, they were buying cars, and then they were driving them really fast, and a lot of times they weren't surviving. Alcoholism among teenagers was a serious problem as well. So they were dying young. The ones that made it past adolescence, of course, they lived into their. I had a very good friend who was in his 80s up there. There was a lady that lived to be 113 on the reservation. So it wasn't the fact that they weren't able to live long enough. It was the fact that they were being so wild when they were teenagers. While I was there for 10 years, and while I was there, there was an accident where six teenagers were killed from the reservation. As horrible a situation as that was, but that's one of the reasons why the life expectancy in a lot of places is very high. A lot of kids die. A lot of babies will die. So the life, and that really draws down the life expectancy. The countries with the lowest life expectancy are all African countries. Malawi is 37.6, Mozambique is 37.5, and Zambia is 37.2. So that's pretty young. That's half my age almost. Three countries in the world with the highest life expectancy are Japan at 80.7, Andorra at 83.5, and San Marino at 81.1. Now, San Marino and Andorra you probably have never heard of. They're tiny little countries in the Pyrenees. The Pyrenees are between Spain and France in Europe. Andorra has only 68,000 citizens, and San Marino has only 27,000 citizens. And you may ask yourselves, well, why in the world are these even countries? And the answer is because they were principalities and they were never taken over by Spain or France, mainly because they were too high up in the mountains and nobody really cared about them. So they do exist as countries. As an example, Flagstaff has 72,402 people, and Gallup has 21,854 people, just so that you can feel how many people are actually in these countries. If you go to Flagstaff, there's more people in Flagstaff than there are in the whole country of Andorra. Life expectancy in the United States is 76.5. This is changing constantly with the pandemic. Of course, this is going to go down because we have a lot of older people that are dying. We have some younger people that are dying from the epidemic, and this will surely lower the life expectancy in the United States. The increase in the life expectancy in the United States is partially due to a deep decline in infant and child death rates in the United States over the last 50 years. I'm 70 years old, and as I said, my life expectancy when I was born was 59. It has gone up 17 years. This is mainly because we've done away with childhood illnesses. When I was a child, I wasn't vaccinated against very many things. I was vaccinated against polio, because there was a polio epidemic in the early 1950s, and I was born in 1949. I was vaccinated against polio, and I was vaccinated against diphtheria, I think, and maybe tetanus, but measles, mumps, chickenpox, all those things, we just had them. And there would be an outbreak in measles, especially measles, and it would kill off, a half a dozen kids because measles is a fairly virulent disease. So now that we can vaccinate against these diseases, far fewer people are dying young as they were when I was a child. Heart disease has been cut in half in the last 30 years. That's mainly because of targeted blood pressure medicine. Death during childbirth is rare now. It's not as rare as it needs to be, but it is rare. Being female is a factor in longevity. 58% of all people over 65 and 70% of all people over 85 are female. So being a female is a good thing. We're going to talk about how there are some negative things about being female. That didn't sound right, but there are some negative things. Your immune system is stronger, so females are more likely to have autoimmune diseases, as it turns out. While life expectancy is a theoretical speculative number, longevity is actually the length of time an individual lives. Many people desire longevity, but most fear extended chronological age, actual number of years in decrepitude. They don't want to live in a nursing home and not be able to take care of themselves. Of course, decrepitude means inability to function on one's own. Biological age is the physical age of the body in comparison to the chronological age. The longest recorded lives have been in the 120-year range. Many gerontologists, which gerontologists literally means old man studier, feel that 110 to 120 years is the upper limit of human genetic endurance. However, with advancing medical research and less traumatic lives, other scientists are predicting longer and longer lives. Many scientists see no reason to place a fixed limit on longevity. And I was just reading an article the other day that was saying that they're estimating that people will start living into their 130s within the next generation. Sorry, needed a drink. What people look like tends to be genetically dictated. Thus, people from one group may look old at 30 while another group maintains their skin elasticity and hair pigmentation into their 60s and 70s. Young adults tend to have smooth, taut skin and their hair has color, fullness, and sheen. Today's 20-year-olds are taller than their parents and they tend to reach sexual maturity earlier than in past generations. This trend is believed to be due to improved nourishment, health care, and less physically stressful lives. Most young adults tend to be quite appearance conscious. They tend to maintain a slim, lean physique and wear clothes that accentuate this aspect of their appearance. As individuals approach middle age, their appearance tends to change. Skin elasticity decreases and facial expressions begin to mold people's faces into character lines. Both men and women begin to suffer from middle age spread, men tending to take on a spare tire, and women to grow larger thighs. Fat replaces muscle, of course, and these are guys with spare tires, and this is a lady's thighs expanding. It's quite a picture, isn't it? Oh, there it goes. Okay, there we go. By late adulthood, physical changes become more obvious. Skin loses some of its color, hence the desire for tan skin among Europeans, and it becomes splotchier. It begins to hang in folds and wrinkles and takes on the texture of parchment. Varicose veins may form in the legs. Hair may turn white and thin. Hair may begin sprouting in odd places. Ears for men, chins for women. So they start growing hair in odd places. Individuals may begin using plastic surgery, heavier cosmetics, or Botox to rid themselves of age lines. They may deny their age and seek symbols of youth. They may take on younger lovers. And this has something to do with midlife crisis. Structural and functional changes. Joints. The joints are protected by a smooth protective cushion of cartilage. With age and use, the cartilage deteriorates and the smooth surface becomes pitted, so your joints don't work as well as they used to. And this is what we see here. This is the cartilage, the meniscus, and there's the meniscus worn down with pits in the bone. The bones become less dense, especially in women who have menstrual and partum drains on the calcium supply that may leave the bones brittle and porous. Partum is Latin for birth, and babies will draw away calcium from the mother, especially if she's not taking any calcium supplements during her pregnancy. The baby will draw calcium away from her. The Germans used to say that for each child, a woman loses 2 teeth. So if you have a half a dozen children, then you would have 12 missing teeth because of the needs of the child. Of course, this is the old days. These kinds of things don't happen anymore because most mothers are taking supplements. As a matter of fact, in Germany, not only is the mother's health subsidized, but also the child is subsidized until they enter school. So they get extra money for milk and for food to feed the child, so that the child will develop healthy. Calcium is constantly being replaced, but in women, bone density loss begins to occur in their 30s. And for this reason, women are advised to either exercise regularly or to take a calcium supplement, especially after the age of 30. Male calcium loss in the bones doesn't begin until they are in their 60s. So for males, of course, they're almost up to their life expectancy before they start losing calcium in their bones. Estrogen plays an important role in keeping blood calcium levels normal. In women, the estrogen promotes the absorption of calcium from the blood and into the bone. When estrogen levels fall, women no longer have the protection of estrogen to protect their bone mass. One of the most vulnerable bones to the female is the hip bone. A woman over 65 has a 1 in 5 chance of breaking her hip. Large bone fractures take much longer for an older individual to recover from than a younger individual. And this is a tragic statistic, but they have determined that if you break your hip after the age of 65, you have a 1 in 2 chance of dying within the next year. And this is mainly because it cuts down on the exercise that the individual is able to perform. And if they're not up and about fairly quickly after they break their hip, then they lose their mobility completely, and they expire before a year is up, unfortunately. My wife has a friend who just broke her hip, and she's having lots and lots of problems, or she broke her hip about 6 months ago, and it doesn't look good for her. Osteoporosis or porous bones is a disorder of old age where the bones become thin and brittle because of calcium depletion. 1 out of 4 women in the United States suffer from this, and we're going to talk about who these women are in just a second. But as you can see, this is what normal bone tissue looks like, and that's what osteoporosis looks like. It is porous bones. It is estimated that 1.3 million fractures a year in the United States are the result of osteoporosis. The spine is especially susceptible to the problem and is characterized by the classic hunchback posture. And there you go, deterioration of vertebral support doesn't allow the woman to lift her neck up. Osteoporosis is more prevalent in white females and more pronounced in women of fair skin and small frames. Proper nutrition and exercise that begins in youth and is followed throughout life can help prevent osteoporosis. Smoking can exacerbate the problem in that it ties up vitamin D that is needed for the proper function of calcium. Arthritis is a general term that refers to inflammation of the joints. Arthritis is common in older individuals, but it can be found in younger people as well. Nearly half of the people over 65 suffer from some form of arthritis. Osteoarthritis is the most common type of arthritis in aging. Osteoarthritis represents inflammation and swelling in the joints. It is also common for this problem to be present when the joints begin to degenerate. Rheumatoid arthritis is a crippling disease that progressively destroys joint tissue. 70% of the cases appear between the ages of 25 and 70. It affects 75% more women than men. Cartilage becomes damaged and the joints become deformed, sometimes fusing together. And this is a problem. This usually is considered, rheumatoid arthritis is an autoimmune disease. As I said before, women have a stronger immune system than men do, and they are more susceptible to autoimmune diseases. And this is one reason why women are more affected by rheumatoid arthritis than men are. Most people detect little effect of aging on their sensory motor systems until they reach the age of 50. At that point, hearing losses become more obvious. This is known as presbyopia, and the lens loses its flexibility, causing presbyopia. That presby means elder. Presbyopia is old eyes, and presbycusis is old hearing. Presbyopia is usually in the form of farsightedness and may require reading glasses. I have to wear reading glasses. I've been wearing them since I was in my middle 50s. I've needed reading glasses. As the individual ages, it becomes more likely that a disease will cause excess pressure in the eyeball, damaging the optic nerve, a condition known as glaucoma. And in order to reduce this, you can put eye drops in your eyes, and that will reduce the pressure. I have a brother with glaucoma, and he has to put eye drops in his eyes. As people reach middle age, many of their senses begin to decline. Besides presbyopia, some individuals may suffer from yellowing of the lens, which filters out green, blue, and violet lights, making color acuity poor. If the lens clouds and becomes opaque, cataracts will form, making vision blurry and out of focus. 1.3 million cataract operations are performed in the United States every year. Older individuals will require more light because of pupil problems. As people drift into middle adulthood, the sins of their past often will catch up with them. If they have not maintained a healthy diet or maintained a frequent exercise regimen, these practices may haunt them in middle age as damage to their cardiovascular system. Atherosclerosis is the buildup of plaque in the walls of the arteries that may block or slow blood flow from a fatty diet. Arteriosclerosis is a loss of elasticity due to the hardening of the arteries from lack of exercise. And there you go. You need to exercise and eat a good diet with less fat. Because of athero and arteriosclerosis, blood pressure is raised. Blood pressure naturally increases with age, but genetics in these conditions can lead to chronically elevated blood pressure or hypertension. This can lead to kidney disease, heart attack, or stroke. Hypertension can usually be controlled through improved diet, exercise, or medication. – That's the famous blood pressure medication that I was talking about. The system that tends to show the least wear and tear from aging is the digestive system. However, as an individual enters middle adulthood, digestive problems can arise. Ulcerative colitis, absorption problems leading to poor nutrition, gallstones, ulcers in the stomach, ulcers in the duodenum, hemorrhoids in the rectum and anus, and all of these are problems of the digestive system. Another digestive problem that tends to occur during middle adulthood is type 2 diabetes, where the cells of the body become insensitive to the body's insulin. Type 2 diabetes becomes a problem with people who carry their fat in their gut and lean toward obesity. There's also a genetic component to this problem and is seen in select populations, especially American Indians. And here are type 2 diabetes risk factors: age, being over 45, being fat, being obese, physical activity, lack of physical activity, of course, having a family history of diabetes, having diabetes during pregnancy, having high cholesterol and high blood pressure. Prediabetes is when the blood sugar levels are high, but not enough for a diagnosis of diabetes. And there you go. I found this really kind of interesting. Having given birth to a baby weighing 9 pounds or more is a trigger for diabetes. One of the most significant aspects of the female's life is her menstrual cycle. For 40 years, a woman's monthly cycle floods and depletes her system of hormones, controlling her reproductive capacity, and in some cases controlling her moods and affecting her behavior markedly. With most individuals, it's not that extreme, but there are some select individuals that are very sensitive to these hormonal changes. During ovulation, when intercourse is most likely to produce a pregnancy, a woman's sight, hearing, and sense of smell are the most acute. During menstruation, all of these senses are the most dulled. Menopause takes place when a woman permanently stops ovulating and menstruating. The menopause usually occurs about a year after the woman's last period. Often women will ease into menopause over a number of years when their monthly cycle begins to become erratic. This is known as perimenopause. The process begins about age 30 when a woman's reproduction of ova begins to decline. As a woman approaches her 50th birthday, she begins producing less and less estrogen. Menopause occurs when the ovaries no longer produce enough estrogen to sustain full menstrual cycles. In 80% of women, menopause occurs between 45 and 55. My wife has a cousin who started menopause at age 35, which was a bit early. When I was working at a rural health clinic in Oklahoma, in Chandler, Oklahoma, we had a lady that came in. She was 73 years old, and she was still having periods, and she wanted the doctor to do something to make her periods go away. Of course, I'm not exactly sure. This isn't a very common problem for women in their 70s to be having periods. She was a funny lady. She was just a hoot. She was a lot of fun. 75% of women experience little or no physical discomfort due to menopause. The most common symptom is known as hot flashes, sudden contractions of blood vessels causing blood to flood to the surface of the skin. Some women have hot flashes constantly, while others have none at all. Other symptoms of menopause include vaginal dryness, vaginal burning, vaginal itching, urinary problems, and vaginal infections. Menopause causes the vagina to become shorter and narrower, and the walls become thinner and less elastic. Lubrication diminishes, which may cause discomfort during intercourse or irritation to the bladder. Vaginal secretions become less acidic. Since the acidity of the woman's vagina protects the woman from bacterial and yeast infections, she becomes more susceptible to infection. Oddly, the more sexually active the woman is, the less drastic the changes in her vagina during menopause. Other symptoms of menopause include joint pain, muscle pain, headaches, insomnia, fatigue, dizziness, weight gain, and constipation. Since the hormones that control menopause are the estrogens and sexual desire is controlled by testosterone, menopause does not decrease sexual desire. However, when vaginal changes create discomfort during intercourse or the woman suffers from other interfering health problems, menopause may mean a decline in intercourse. Some women may go through a sexual adjustment where physical responses aren't as extreme as they had been before. Oh, let's stop talking about women. Let's start talking about men and what happens to them. This is known as male climacteric. As men age, things change. They don't change as drastically as they do for females because males still can reproduce, and females, of course, once they go through menopause, they can't reproduce anymore. But for a male, he just kind of slows. Things tend to slow down. In the male, testosterone begins to decrease beginning in the late teens, as weird as that may seem. So the sex drive is the most extreme in the late teens, when you're 18, 19, 20 years old. By the age of 70, testosterone reduction has reached between 30 to 40%. The lower testosterone and other sexual problems may lead to an old age of impotence, meaning that they're not having sex anymore. The prostate gland may swell and make urination difficult and erection incomplete. As males wander into their 50s, they may begin to feel their physical decline and waning testosterone level. They may experience depression, anxiety, irritability, insomnia, fatigue, weakness, lower sex drive, erectile failure, memory loss, reduced muscle and bone mass, and excessive body hair. Many men, as they age greatly, fear the loss of their sexual potency. It isn't true that as males age, they naturally lose their sexual functioning. This is basically a cultural idea. And the weird thing is that a lot of things have to do with how your society or how the culture that you live in sees these things. So you may live in a culture that thinks that women over 40 shouldn't have sex anymore, or that this is the way it was during the Victorian era, or that males aren't able to get erections anymore. And this just has to do with the way your culture views these things. Very often, lessening of sexual activity is due to non-physiological reasons: monotony in a relationship, preoccupation to business or financial worries, mental or physical fatigue, depression, failure to make sex a high priority, fear or inability to perform. Physiological problems include diabetes, alcohol, and medication. Male sperm count begins to decline when a male is in his late 40s or early 50s. Erections tend to become slower and less firm. Orgasms less frequent. Ejaculations less forceful. It takes longer to recover and ejaculate again. And that's the guy that just reached his 50th birthday. 39% of 40-year-old men experience some sexual dysfunction. 5% of men in their 40s are unable to get and hold an erection. 67% of males over 70 experience some sexual dysfunction, and 15% are completely impotent. Erectile dysfunction may be caused by diabetes, hypertension, high cholesterol, kidney failure, depression, neurological disorders, alcohol, drugs, smoking, poor sexual techniques, or unsatisfying relationships. Aging does not have to spell the doom of a couple's sex life. With many couples, menopause is liberating since the couple no longer has to worry about unwanted pregnancy as a result. The bottom line is that age has nothing to do with sexual desire, drive, and desire. Sexual expression may change its focus as a person ages. but couples are able to have sex as frequently as they want to have it. And of course, it isn't dirty just because it's grandma and grandpa, okay? In many families, middle-aged mothers tend to have the role of kin keeper, the person who gathers people together for celebrations and keeps them in touch with one another. Sometimes middle-aged parents are referred to as the sandwich generation because they are sandwiched in between aging parents and difficult adolescent children of their own. During middle adulthood, successful adults are able to maintain their mental capacities by adapting to their circumstances through selection, optimization, and compensation. They are selective as to what they do. They optimize their abilities. They compensate when necessary. By using SOC, the individual is able to maintain their level of competence, regulate their losses by reorganizing their functions, and growing through adaptation. By focusing on what they are good at, middle-aged individuals are able to develop expertise, extensive experience, knowledge, and understanding of a specific area of interest, and that's what expertise is. The antithesis of expertise is a novice, someone with very little experience, knowledge, and understanding of a specific area of interest. And for this reason, a lot of older individuals don't take up new things. And of course, this has been the problem with new technologies. Things are, they have been doing so many things throughout their lives that they feel like they don't need to take up brand new things, to learn new things. It makes them feel and look stupid, I guess. People with expertise may have a wealth of knowledge in an area, but will only use a small amount of that knowledge in any one situation, an aspect referred to as conditionalized knowledge. Even experts have different levels of competence. Individuals who have expertise that is basically routine are referred to as merely skilled experts. Those experts who can not only answer routine questions about their subject, but have such extensive knowledge that they have adaptability, flexibility, and creativity are referred to as highly competent experts. Highly competent experts become problem solvers in their field and can create strategies to expand their knowledge and develop new skills. This is known as adaptive expertise. I was thinking about this the other day as I was driving home from Saley. And I was thinking, thinking about some of the classes that our instructors or your psychology instructors are teaching, and the fact that some of us have specific expertise in specific areas. Then I realized, yeah, but I teach all the classes, and the reality is that most college professors only teach a very small number of classes, and they teach the same classes over and over again. That's because they have expertise in those areas. But I'm a generalist. In other words, I have some knowledge in a lot of different areas, so I teach everything. And that's one of the reasons why a lot of college professors, if you go to Northern Arizona University, NAU, or ASU, or Arizona, you will have a professor that only teaches two different classes, or maybe three different classes. Usually it's three different classes, because and they just teach those same classes over and over again. I have a good friend who used to teach. He's not teaching anymore. He's too old. He's younger. He is older than I am. He's a year older than I am. So, he was teaching at the University of Montana, and he would teach 3 classes a year. He was actually only teaching 3 classes a year. And of course, at the same time, I was teaching 7, 8 classes a semester. And he was kind of amazed that I had that ability to do that, because at his institution, of course, you need expertise. You need to be an expert in that field in order to teach it, but we don't have that luxury at Diné College. I don't know why I even talked about that. Okay, working memory. Working memory is a kind of notepad in the mind for storing information in the short term so that it can be dealt with. In fact, working memory used to be referred to as short-term memory. Working memory only holds from 5 to 9 chunks of information at any one time. Working memory can be enhanced if the individual arranges the information in larger chunks, and this is one of the reasons why we don't, when we're talking about the year, we don't say 2021, we say 2021 because we're chunking it together. And that's the way usually you remember your telephone number. You don't remember them by individual numbers. You remember them as a chunk of numbers. Okay, well, still the working memory can only hold information for about 30 seconds before it begins to decay and possibly distort. Another enhancement tool that is frequently used is rehearsal, where the individual re-enters the information into the working memory by repeating the information. Researchers feel that as we age, the capacity of our working memory tends to shrink. Shrinkage tends to have a great deal to do with the complexity of the task required and the technique used in memory enhancement. If the individual is using rehearsal as their memory technique, they tend to show very little decline. Any information that requires more sophisticated memory enhancement tools, such as reorganization, elaboration, or mental manipulation, there is a greater decline. Some researchers feel that as a person ages, they lose attentional resources. They have less ability to maintain their attention on a select item. However, their researchers cite motivational lapses that might preclude an older individual from trying too hard on such nonsense. And so what we're talking about in memory, one of the ways that they do research is they put together nonsense syllables that don't mean anything. Now, when you're 20 years old and you're doing this, this may not be that big a deal, but when you're 65 years old and people are asking you to memorize nonsense syllables, it may not make a whole lot of sense. It's really kind of silly. So the real question is, one of the factors, one of the variables in research is your motivation. And so the problem may be not that older people have less ability to remember things, but they need more motivation. It needs to make sense for them to do it. Whereas younger people, you can talk them into just about anything. But older people, they're a little bit less willing to do silly things. Scientists have recently, and of course this is one of the problems of research, that motivation is a big problem in research, or is one of the variables that they don't really deal with all the time. Scientists have recently been researching how select information is processed. Explicit memory is conscious or intentional recollection. Most often it's facts, names, events, or other things that people can state or declare. Implicit memory is memory that occurs without conscious awareness. Most often it's skills and habits like throwing a ball or riding a bike. You get up on a bicycle and you start pedaling along, and you don't have to remember how to balance because that is your implicit memory. You have that information. You grab a hold of something and you want to throw it. You do it in the manner that you've always done it. That is implicit memory. That's also muscle memory. Brain scans of people recalling implicit memory shows that there is a specific memory pathway that takes place when recalling this information. There have been some interesting findings looking at the effect of the sex hormones in memory. Dealing with animal studies, researchers have discovered that increased estrogen levels, as with birth control pills and hormone replacement therapy, decreases a woman's spatial reference memory, memory for location and space. Now this is really kind of scary because they were treating osteoporosis with hormone replacement therapy. And of course, they were doing this without a lot of research. And what they discovered was it was affecting women's memory because they were using this estrogen. Looking at male subjects, they found that when they increased their testosterone, they increased spatial reference memory. Of course, you wouldn't want to give a woman testosterone because she would start growing hair in funny places that she didn't want to, like on her chin and on her lip. Many parents, especially some women, so strongly identify with their mothering role that when their last child finally leaves the house, they may suffer from bouts of loneliness and feelings of worthlessness because their role has changed from the center of their children's lives to the periphery of their children's lives. I haven't talked to my son in 6 months. My daughter lives here in where I live, so I see my daughter all the time, but I haven't talked to my son in probably 6 months. Um, and that's okay because he's got a life and he's working every day. He's coaching soccer. He's teaching calculus to high school kids. So he's got lots of stuff to do, and he doesn't have a lot of free time. And he's trying to get into the FBI, so that ought to be interesting. But this is known as if you feel this way, if you feel lonely, if you feel sad, if you have bouts of depression, this is known as the empty nest syndrome. Fathers also may suffer from empty nest in that they may regret not having spent more time with their children because they're working all the time. Of course, this has to do with the old days, back in the 20th century, rather than more the 21st century, where things are a little bit more balanced. Okay, so the question is, do opposites attract? Not usually opposites do not attract. That's not the way it works. Most people fall in love with and marry someone much like themselves. This is known as assortative mating. Assortative mating. In fact, people who are about equally attractive are the most likely to develop close relationships. Lovers often resemble each other in physical appearance, attractiveness, mental health, physical health, intelligence, popularity, and warmth. They are likely to be similar in degree to which their parents are happy as individuals and as couples. Couples tend to be similar as to their socioeconomic status, race, religion, education, and income. They often have similar temperaments. They often have similar interests. Researchers have found that people are usually more cognizant of why a failed relationship dissolved than why they got together in the first place. And here are pictures of happy couples. One of the things I want you to notice is the fact that their hair tends to be the same color. As curious as that is, this lady dyes her hair blonde. You can see her eyebrows are brown. It's about the same color as his hair. Same thing with this lady. You can see her roots here. Her hair color is about the same as his. And of course, there's some Asian. That's an Asian couple. As you can see, their hair color is about the same. Her hair is darker than his. Yeah, her hair is a little bit darker than his. There we go. Same color. Same color. And of course, these two couples are no longer together. This is Brad Pitt and Angelina Jolie, and Tom Cruise, and I can't remember her name. Anyway, that's yeah. Everybody tends to have hair that is very similar in color. Later years, the ability of older couples to handle the ups and downs of marriage results from mutual supportiveness, intimacy, both sexual and emotional intimacy, interdependence, sharing of tasks and resources, the partner's sense of belonging to each other. In the United States, the average age of grandparents at first grandchild is 50 for women and 52 for men. For me, I was 64 when my daughter had my grandson. Minorities usually achieve grandparenthood at a younger age than whites. 75% of older Americans are grandparents. 40% are great grandparents. Families are getting smaller. They are about a third as large as they were at the turn of the 20th century. In developing countries, the role of grandparent is one of counselor and financial benefactor. In the United States, grandparents often act as teacher, caretaker, role model, and negotiator. But this is only about 15% of grandparents. An involved grandparent represents 15% of the grandparents involved to the extent of disciplining or correcting their grandchildren. They give advice, they discuss the child's problems, they are consulted on important decisions concerning the child, exchanges help with errands, chores, and projects. They help wherever they can. Younger grandparents, those who see their grandchildren almost every day, and those who have a close relationship with the child's mother are more likely to be involved. Grandparenting styles may differ with different grandchildren and at times in a child's life. The most involved years tend to be when the grandchildren are pre-adolescents. In my grandson's case, my wife and I are very involved in helping take care of him. My daughter was living in Florida around the father's parents, and they weren't nearly as involved. They didn't want to be involved in the kid's life, and it's just that was part of their culture, and of course that's not part of my culture. My culture is very family oriented. My parents were very involved in all aspects of our lives, and they even helped us after we were out of the household. And that's the way I was raised. So that's the way I do things as well. But the father's family is relatively wealthy, and wealthy people are just a little bit more standoffish than people that don't have a lot of money, I guess. One researcher from the 80s sees grandparents as family watchdogs. They often stay on the fringes of their children and grandchildren's lives, rarely playing an impactful role unless there is a need. In a crisis, they will step in with financial or emotional support. One study in 1987 found that 14% of preschool children were under the care of grandparents during the daytime. Grandmothers tend to have closer, warmer relationships than grandfathers with their grandchildren and to serve more often as a surrogate parent. The mother's parents tend to be closer than the father's parents and are more likely to become involved in a crisis. Grandmothers tend to be more satisfied with grandparenting than grandfathers, though grandfathers tend to be warmer to their grandchildren than they were to their own children. Many feel that it is a second chance to do a better job at parenting than they did with their own children. 7% of children in the United States live in households headed by a grandparent. One-third of these children have no parent present in the household. In some low-income areas of the United States, an estimated 30 to 50% of children are living in kinship care, living in households with grandparents or other relatives without their parents. Many of these children may have behavioral or learning problems due to a parent's abuse of alcohol or drugs. 68% of grandparent caregivers are white, 29% are black, 93% of single grandparent caregivers are women, 40% of grandparent caregivers are poor or just above the poverty level. Two-thirds of the custodial grandparents report a greater sense of purpose in life. Often the age difference between the grandparents and the grandchildren can be a barrier between them. They may feel anger or guilt for raising children who do not take care of their own children. They may feel that it shows that they themselves have somehow failed as parents. Age discrimination refers to denying someone a job or promotion solely on the basis of age. The Age Discrimination Employment Act of 1986 protects workers over 40. This law states that people must be hired based on ability rather than age. This law will not allow employers to hire or fire using age as their sole criteria. The law also keeps employers from segregating or classifying employees using age as the basis for this classification. Research shows that the idea of retirement is not universally accepted. The responses fall into three categories: those who are so attached to their work that they cannot imagine retiring, that's me; those who are looking forward to retirement as an opportunity to do things they hadn't done before; those that have mixed feelings or hadn't yet thought much about retirement. And that's me as well. That's not me on the right. In Germany, only 3% of older adults still work. In Japan, the percentage of older adults still working is 28%. In the United States, 16% of older men and 8% of older women are still in the workforce. In 1900, 67% of men over 65 were still in the workforce. In 1950, 50% of men over 65 were still in the workforce. So you can see things have changed over time. Individuals who continue working tend to be better educated than individuals who retire and tend to be in good health. Many people finance their retirement in various ways: social insurance, such as Social Security; universal pensions. Some countries automatically give each retired individual a pension; and voluntary pension plans. Most companies in the United States and Britain are allowed tax deferments to maintain a pension fund; and provident funds similar to Social Security, but people get it all in one lump sum after they retire. So these are 4 different ways of doing retirement in different countries. While many people do prepare for retirement, most, just under half, don't even think about it. But even the individuals who tend to aim too low. Savings programs need to be maintained at higher levels than most people are maintaining them. What do people do after they retire? Many maintain supplemental paid jobs. People who were self-employed before retirement tended to work at least part-time after retirement. Volunteerism: 1 out of 3 people over 75 do volunteer work. 40% of all retired people do volunteer work. That didn't sound very well. Okay. Leisure: people tend to find a focus after retirement. Some people maintain a family-focused lifestyle that means moving closer to their grandchildren. Some people maintain a serious leisure where they must maintain skill and concentration in their endeavors. About 11% of U.S. retired people live in poverty. This is down from 35% in 1959 and the vast majority before Franklin Roosevelt passed the Social Security Act. After retirement, age often dictates poor health, but the vast majority of people are fairly healthy, both mentally and physically, until just before they retire. Erickson's 7th crisis occurs at least by the beginning of the middle childhood and lasts until middle adulthood, and lasts until retirement. The crisis involves whether the individual will guide the next generation or whether they will focus on their own needs. This crisis is often resolved as soon as the individual decides to have and raise a family. People who put off relationships and a family are often too self-absorbed to care about generativity. In 1968, Robert Peck looked at Erickson's idea of generativity and expanded on how people change their focus as they enter middle age. Valuing wisdom instead of physical powers, socializing instead of sexualizing human relationships, concentrating on many people rather than investing all of one's time on one individual, mental flexibility instead of mental rigidity, and this guy's name is Robert Peck, but I'm not sure that's the right guy. I couldn't find. I'm not sure. Anyway, it could be Robert Peck, but maybe it's not. That is the end of your chapter of chapter 11. We have 2 more to go. So there you go. I'll talk to you guys next week, I guess. Let me turn this thing on.